ago, I said we need 100 to 150,000 tests a day. Our best guess is that we're doing about 30 to 35,000 tests. So that's what we did yesterday. So we're making progress. We're making a lot of progress, but boy, we're still far away from where we need to be. And even if we do all the other things we're doing, shelter in place, taking a national pause, testing is fundamental to our strategy for beating COVID-19. So the fact that we're still not up to speed is troubling. The good news here is we're making progress, and I'm hoping over the next few days, maybe the next week, we'll finally get to a point where we have enough tests. But boy, it's taken a long time.
Yeah, absolutely. Not taking that WHO test strikes me as the single biggest mistake. Well, there have been a lot of mistakes, but this administration not just taking that WHO test that every other country in the world is using is just, to me, shocking that they didn't do that. But I'll move forward. Let's talk about the shortage of masks, because one of the big concerns here is that the people who have to take care of people are also at risk because they just don't have the equipment. Dr. Patel, you now have in New York, where actually I think a lot of people have to really give Governor Cuomo credit for doing a really good job communicating and trying to make it work in a state that has so many cases. Faced with a shortage of face masks, some U.S. doctors are making their own. You have in New York the governor saying to fashion designers and people who make clothing that they'll pay them to make masks. How could it be that a country with so many high-level medical facilities and award-winning, brilliant hospitals just don't have enough masks? Is that a shortage? Is that a normal thing for a country of this size not to have that number of or enough masks just for our medical community to use?
Joy, there's so many things about what's happening today that are not normal in any regard, and I think the fact that this is a completely novel virus for all healthcare professionals, we are learning that it's really only when you have this head-to-toe kind of protective personal equipment that you can really be safe. And to be candid, the guidelines tell us that if you're in contact with these respiratory droplets, you have to take it all off, throw it away, and start again. And that is not something that we've had in a conventional setting at this scale. Every hospital has respiratory isolation rooms and all this equipment, but nobody projected that we would need 1,100 beds to be filled and staffed with this level of equipment. But I have to go back to something you've commented on. This is a failure from the president to not take this seriously. That sent a signal to even the public sector and the private sector, well, we'll just wait. And now look what's happening. You've got people on Facebook asking if you can drop off boxes of masks in order to protect themselves. And doctors and nurses who are being told, you will probably get sick, and you still have to work through it because we can't afford to lose you.
Hey, thanks for checking out our YouTube channel. Subscribe by clicking on that button down there for more AM Joy and the rest of MSNBC. And click on any of the videos right here to watch the latest interviews and highlights. And you can get more videos from MSNBC for free every day with our newsletters. Just visit msnbc.com/newsletters to sign up now.